there is a shortage of anesthesia providers across the country.
The fact of the matter is we lose more practitioners per year than we train.
What we've always done is put a heavy emphasis and focus on the education of the next generation of physician anesthesiologists.
One of the fun and exciting things about having a new program is that there's very much a blank space. There's a lot to create. It's a ton of work. I don't want to minimize how much work it is, but it's work that you can be creative into.
We reached out to our hospital partner at the time, Vassar Brothers Medical Center. Together with our assistants, applied for the American College of Graduate Medical Education to start a anesthesia residency program there.
I think one of the biggest both challenges and rewards of developing a residency program is working iteratively both with the faculty and the residents to create something that really works at educating residents in the types of things that they need to be strong anesthesiologists, but also the types of thinking required for anesthesiologists to be able to make decisions quickly in the operating room.
It takes a while to season. So, the first 4 or 5 years of a residency program are really just trying to establish all of the norms and making sure that you're going to get the cases, that you have the faculty. Now you try to proliferate, and that's always a much harder step.
There was never the assumption that we knew exactly how to build a program the right way.
Starting the residencies at the time that they did, it sort of reset everyone's mindset. Some of our faculty at that time had been in a private practice for more than 2 decades, and they had never taught.
I think there's so much opportunity in such a young program that's yet to be discovered. I left going to Utah, I did a regional anesthesia fellowship. One of the things I felt coming back was I know I could have an immediate impact on both the residents and the department and the hospital.
So the program is, I feel like, definitely way different from when I matched to what it is now, and I mean that in the best way possible. This residency program does a really good job of giving you autonomy as early as possible. Obviously, we work with our attendings very closely. It is a smaller program, so they know us well. They know what our skill sets are and if we're ready to move on to that level. And I feel like if I had to go out and be an attending in a couple months, I feel pretty ready to do that.
A smaller program allows for a closer, I would say, collegial relationship between the attending and the residents, and also between the residents themselves. They are not lost in a large program compared to some of the programs that we have in New York City.
One of the most important things that the residents need to recognize is examining their own thinking, looking at their own cognition, how they make decisions, where their biases and blind spots can sometimes lead them into trouble, how to recognize that, and how to avoid some of those pitfalls when they're making clinical decisions in and out of the operating room.
You have to get used to being okay with things not being perfectly fine and being comfortable with the uncomfortable things. That's what makes you a better clinician. That's what makes you take on the challenging cases that nobody particularly wants to do. That's what helps drive innovation. It's okay that you're uncomfortable with things, and that's part of training. That's part of growing in your career.
It's okay to make mistakes. That's the best advice. Every day is a new learning opportunity, and you're going to be fine. You can't get through this program and not learn anesthesia.
At the end of the day, at the end of a resident's 3 years in our program, I have to sign a form certifying to the ABA that this resident can be an independent practitioner, that they can be a candidate to be a diplomate in the American Board of Anesthesiology. And I take that responsibility really seriously because there are people on the other end of that decision. There are patients at the other end of that decision.
Right now, we've done the first 4 years. We have the proof that this works. Everyone's passed the boards. Everyone's gotten the job that they wanted. Everyone's gotten into their fellowship specialty of choice. Now, these next 4 years, you just have to prove it over and over again.
Anesthesia was one of the fields that I felt combined the aspects of medicine and surgery into one. There's so many different avenues within anesthesia. In a day, I could be doing anesthesia on an obstetric patient, and then within an hour go to a thoracic case, and then later on the day I go do an orthopedic case, and then a neuro case. I enjoy seeing my interventions do something immediately. You know, I give a medication, it changes blood pressure, it changes heart rate, or it changes their pain. I perform a procedure, it's something that occurs instantly.
I'm excited for the future just to see what it holds, what my first job is going to be like, where my co-residents end up, where we all end up being attendings, fellows, things like that. I think throughout the residency program, I grew pretty close to my class. They're my favorite people.
That's what's fulfilling, is seeing other people develop a sense of a community in anesthesia and seeing how they can further help the field. And so inspiring others to further something you're already passionate about is what really is rewarding.